Are you prepared for how your birth plan could affect your pain, your sleep, and your baby's health long after delivery?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining new research presented at the Anesthesiology 2025 meeting that links cesarean delivery to more severe postpartum pain and significantly disrupted sleep, and will outline specific practical steps you can use to reduce the chance of an unnecessary C-section and support recovery if you need one.
I'm Alara Sky. We'll walk through what the Stanford team found, why C-sections carry added risks for you and your baby, how surgical birth alters early microbial exposure, and the actions you can take now. Provider choice, weight management, movement, labor support, stress control, and targeted postpartum care.
More than 1 in 5 babies worldwide are born by C-section, and projections suggest nearly 1/3 of all births by 2030. Some cesareans are medically necessary, but many occur without a clear indication. The new study compared mothers with surgical and vaginal births and found that over 2/3 of C-section mothers reported pain strong enough to disrupt sleep and daily activity. Among planned surgeries, 73% reported sleep-disrupting pain. 67% did after emergency procedures. Only about 8% of vaginal birth mothers reported similar discomfort.
Using nationwide data from more than 1.5 million births between 2008 and 2021, the researchers also found that mothers who delivered by C-section were 16% more likely to develop new sleep disorders within 1 month to 1 year postpartum. That includes insomnia, sleep deprivation, and obstructive sleep apnea. The message is clear. If pain isn't managed early, it feeds a cycle of poor sleep and slower healing.
Lead author Dr. Mo Takanoshita emphasized intentional recovery strategies. Align rest with your baby's sleep when possible. Avoid caffeine and alcohol during recovery. And add gentle movement or relaxation practices such as warm baths or deep breathing before bedtime. If you're struggling with sleep during pregnancy or after delivery, raise it with your physician and ask about a specialist referral when needed.
Beyond pain and sleep, the surgical route carries additional risks. Post-surgical infection can occur at the incision or internally as endometritis. Signs include fever, abdominal tenderness, heavy bleeding, and abnormal discharge. Recovery generally takes longer because multiple tissue layers must heal. Surface closure may happen in 4 to 6 weeks, while deeper tissues can take up to 3 months. C-sections also raise the risk of postpartum hemorrhage, blood clots, and future pregnancy complications such as placenta previa or accreta. Emotional effects, anxiety, sadness, disappointment, are common, especially after an unplanned surgery.
Your baby is also affected by how birth occurs. During vaginal delivery, your baby is coated in beneficial microbes from your birth canal and gut. That initial seeding helps train immune recognition and supports digestion. With a C-section, the first microbes are more likely to come from the operating room environment and caregiver's skin. Studies show reduced microbial diversity and fewer bacteroids and bifidobacterium in C-section infants, organisms important for digesting milk sugars and strengthening the intestinal barrier.
That altered seeding has downstream effects. Immune education is less complete, and your child's risk of allergies, eczema, and asthma increases. Microbial imbalance may lower production of short-chain fatty acids, which support metabolic balance. Children born by C-section show a slightly higher risk of obesity and metabolic issues. Breastfeeding, skin-to-skin contact, and delayed bathing help nudge microbial exposure in a better direction. Vaginal seeding is being studied, but safety and long-term outcomes remain under review.
There are other baby-related risks to be aware of. Accidental skin nicks occur in an estimated 1% to 3% of cesareans. Respiratory distress is more common because labor contractions that help clear lung fluid are bypassed, increasing the likelihood of rapid breathing and the need for supplemental oxygen or NICU observation, especially when surgery occurs before labor begins. Large population studies also report a modest increase in autism diagnoses after cesarean birth. Proposed mechanisms include altered microbiome development and differences in birth-related hormonal exposures. Researchers caution that cesarean delivery isn't a direct cause, but the association is consistently observed.
If you want to reduce the likelihood of an unnecessary C-section, start with your care team. Choose a provider who supports natural birth. Ask about their C-section rate, induction policies, and experience with VBAC. Continuous labor support from a doula, midwife, or experienced birth coach is associated with lower cesarean rates by helping you manage discomfort, advocate for your preferences, and keep labor progressing.
Your daily habits matter. Maintaining a healthy weight lowers the risk of preeclampsia, gestational diabetes, and cesarean delivery. Aim for adequate protein, about 0.8 grams per pound of lean body mass, plus colorful fruits and vegetables rich in antioxidants. Ensure sufficient folate and iodine for fetal development. If tolerated, include small servings of wild-caught fatty fish, such as sardines or Alaskan salmon for DHA and EPA. Keep intake moderate because omega-3s are still polyunsaturated fats. Minimize linoleic acid by avoiding vegetable oils like soybean, corn, canola, sunflower, and safflower, and limit other high LA sources such as nuts and seeds.
Stay physically active unless your doctor advises otherwise. Walking, swimming, prenatal yoga, or resistance exercises strengthen pelvic and core muscles, improve flexibility, and build endurance that supports efficient labor. When it's medically safe, allow labor to begin and progress naturally rather than scheduling an early induction. Early epidural use or artificial induction can slow contractions and cascade into interventions that make surgery more likely.
You can also encourage optimal fetal positioning, pelvic tilts, time on hands and knees, and avoiding long hours of reclining help your baby settle head down, which may shorten labor and reduce assisted delivery. Manage stress and prioritize rest. Chronic stress raises cortisol and adrenaline, which can interfere with oxytocin, the hormone that drives contractions. Use deep breathing, meditation, light stretching, and consistent sleep habits throughout pregnancy.
If a C-section becomes necessary, support recovery with steady, simple actions. Keep your incision clean and dry, wear loose, breathable clothing, and check daily for redness, warmth, swelling, or discharge. Most infections appear within the first 2 weeks. Manage pain proactively. Early on, cold compresses reduce swelling. Afterward, gentle heat helps relax muscle tension. Curcumin and magnesium can help calm inflammation, and ginger or chamomile tea can aid relaxation.
When your provider clears you, begin short walks and light stretching to restore circulation and reduce clot risk. Avoid lifting more than your baby until tenderness fades and the incision is fully healed. Add core and pelvic exercises gradually as swelling resolves. Nourish healing with protein, vitamins A and C, zinc, iron, copper, selenium, collagen, and B vitamins. Practical choices include pastured eggs, wild-caught fish, mineral-rich bone broth, grass-fed meats, organ meats, and whole fruits and vegetables. Hydrate to deliver nutrients and clear waste products.
Protect sleep quality even if quantity is limited. Keep your room dark and cool. Block outside light with blackout curtains. Reduce noise. Limit screens before bed. And consider unplugging nearby devices or turning off your Wi-Fi router at night if possible. Align rest with your baby's sleep whenever you can, and avoid caffeine and alcohol during recovery to protect sleep and healing.
Here's your challenge. This week, write down your provider's C-section rate and policies, identify one action to lower linoleic acid in your diet, choose one movement practice you can do most days, and list 2 concrete steps to protect your sleep environment after birth. Share those notes with your care team and partner so you have support in place before labor begins. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.